you said something in there that I want to talk about. I want to touch on a little bit more is let's talk about the clinician who is also the health coach. So like for me, I come from a traditional medical model. I'm trained clinically as a nurse practitioner. You as well, trained clinically as a physical therapist and in clinical nutrition. So let's talk about that. Like how can that person, that clinician who is maybe trained in that traditional medical model, but wants to dive a little bit deeper or wants to have more collaborative, connection with their client, how can they take these skills, the skills that you learn in coaching, and incorporate that with what they know, whether it's in their current practice, whether it's opening up a different practice? What does that potentially look like for a clinician who may be interested in exploring whether coaching is the right thing for them?
I think intuitively, many clinicians actually would prefer to be coaches. They kind of went to graduate school thinking they were going to be coaches, right? Thinking they were going to learn how to sit with someone in the experience of their illness or injury and help them to really focus on how to heal. But unfortunately, the way our medical model, our conventional medical model, and even to some extent our integrative medical models, because sometimes that really shifts into just sort of like green pharmacy, like what's the supplement instead of what's the medication. Those traditional models of how the relationship is between a provider and a person seeking support for their healing is so both kind of patriarchal. There's this sort of patriarchal power differential, and the person who's giving the recommendations has this ownership of like, they have to fix you like you're some kind of broken car, literally. And it's like, what series of, whether it's supplements or medications or surgeries, and how quickly interventions, PT, acupuncture, whatever, what those interventions do to sort of just like fix the physiology. And it's a very frustrating model, not just for patients, but also for professionals, for health professionals, because there's a lot of stress. There's a lot of pressure of taking ownership of things that they actually don't have any control over, right? Like you cannot go home and sit with each and every one of your clients and see what they're having for dinner. You just can't, seeing if they're getting up in the morning and going outside to take their walk. Like you just don't have any control over that as a clinician giving a recommendation. And then there's the challenge of not enough time and intense productivity pressure and not being able, really allowed to think holistically. And I see this across the board: nurses, physicians, physical therapists, occupational therapists, massage therapists, acupuncturists. Like they're just under intense pressure to just see as many people as they can in a day and focus on one little piece of the puzzle. And intuitively, I think professionals want the time and space to see how they can help people really heal from the root cause. But our system is not set up like that. So what happens is then a clinician will join our health coaching program. They'll gather these skills and they're afraid that they won't have the capacity to actually do this in the real world, because they're like, wait, I know what's going to happen to me if I go to nursing school, I get a nursing license, I go get a job in a hospital. I know it's going to be a lot of pressure. I know it's going to be exhausting, but I also know I'm going to get a job. I'm going to be able to work X number of shifts. I'm going to make a certain amount of money, more or less. And there's a safety in that. But over time, people just get exhausted and really can't keep up that pace. So one of the things that I did deliberately, because this has been a fear of people making this transition to be able to both either purely coach or coach as a clinician, and both are great paths. Either one works well. I really still, in my private practice, coach as a clinician. So I could get to bring in all of my hats, which is actually wonderful. And either of those things can work and do work well with long-term business support. And that's what we offer here, because at the end of the day, and also because there are increasingly jobs in coaching, more and more and more, which is why we have committed to the rather complex and difficult, time-consuming process to make the Women's Health Coach certification, NBC-HWC certified, because we want our graduates to have the opportunity to get those jobs, those more defined, for some people, safer feeling jobs. And we can currently offer them space over time, both in our program and when they graduate. There's lots of opportunity. I'm on live calls 3 times a week to help our clients and our students and graduates develop the exact kind of practice that they want. And one of the things that's really important about how we do that is there's not like a 6-step process to 100K or, whatever you see from business coaching, because everyone's vision, we do everything in the coaching model, and each clinician and coach's vision is different. And this way we have the opportunity and we have the experience. I've been doing this since 2006 and officially since 2009. We have the experience to have seen hundreds of successful, totally unique kinds of businesses. And I think that gives us the insight to help people figure out what the exact right kind of business or practice or job or career fits them. And I think that really helps to ease that fear of, how can I make this work? Well, we've seen it hundreds, if not thousands of times at this point.
Yeah. And I think it's important, like you said, to fit. That's so coaching, right? To fit them. So really to fit their life, to fit their bandwidth, to fit what lights them up, how they want their business to look like, or potentially how to incorporate all of these skills into a clinician role or a different health coaching role. We've seen so many students be able to take these skills and incorporate it in so many different avenues. We've had them incorporated into programs at the VA. We have two students right now, actually, and a master coach who is utilizing these coaching skills to help the VA to create kind of a whole system, a whole body approach to women's health at those centers. We've seen social workers incorporate those skills into their current practice, or to start a whole new, practice where they're using these skills on their own. Students get jobs employed as health coaches through doctors' offices, or for example, for me, even having that credential before I started this role actually opened up so many doors for me as a nurse practitioner. There's more and more doctors' office, hospitals looking for people who are certified coaches, health coaches, to join their team. And I think it's also really important to mention not just on the live coaching calls, like all your years of training and skills of running a successful practice, starting practices, helping students grow their practices, but they also get this on a one-on-one basis as well, in particularly the program with their master coaches. They have the ability to discuss their vision, their dreams, what they're looking for, bring it to the live calls, and can discuss with their coach on their one-on-one calls what that looks like, how to bring it together, what the next best steps are, which you don't see in, I don't know, if any in any other programs.